And tonight's Health Watch, if you cannot get a decent night's sleep because your partner snores, or maybe you're the offender, help is on the way.
That's a fair statement. And guess what? It is a simple treatment. CBS 2's Dr. Max Gomez here to tell us what that means and how this works.
Well, some people call it a facelift for your palate. I bet you never thought you needed a facelift for your palate, right? Well, what we're talking about is a flexible part of the roof of your mouth called the soft palate that vibrates when you snore. That's what gets lifted. This isn't the same as sleep apnea, although the two often happen together. This is plain snoring, and here's a fix. Snoring is the subject of a lot of jokes, but it's no laughing matter. Studies have shown that it's linked to health risks from high blood pressure and diabetes to even learning disabilities in children who snore. And it's not just men. About 25% of women snore, somewhat less than the 40% of men. And the sound of snoring can vary, as Diana Yazarov demonstrated her husband's snoring for me.
Like...
Diana's been putting up with Michael's snoring for almost 20 years, which, like most couples, doesn't really bother him.
Usually it wakes her up first, then she wakes me up.
But enough is enough, so when Michael heard of a minimally invasive office procedure called an alevoplasty, he and Diana went for it. The developer, Dr. Joseph Crespi, director of sleep disorders at Lenox Hill Hospital, explained why some call it a facelift for your palate.
It lifts the palate, suspends the palate upwards, opening the airway.
First, there's local anesthesia of the palate. Then 3 absorbable sutures are placed along the length of the palate. These sutures have tiny barbs that anchor them and allow Dr. Crespi to slightly tighten them to get that palate lift. Over time, a little scar tissue forms to further stiffen the palate.
Feels a little numb, but it's not much pain.
But
it's not a cure for snoring. It should improve the intensity and the loudness of the snoring,
which is all Michael and especially Diana are hoping for.
I'm hoping I will have to sleep at night without any interruptions.
Now, after a couple of days of a mild sore throat, the results kick in, and studies show that so far, the results last for over a year. The bad news is that insurance doesn't think snoring is a medical problem, so it does not cover it. Cost is $2,500. And before they decide to do this, they do a sleep study to make sure it's not sleep apnea that you've got, because then it's not really appropriate. It's just for plain snoring.
So it wears off after a year, then you got to do it again?
Well, no, a year is how long they've been following it. It's recently FDA approved, so that's how long they followed it. It could be much longer.
Got it.
We'll see.
Good night's rest might be worth the money.
Yeah, it could be.
It's not asking too much.
Thank you, Dr. Max.